for those of us who've had a lot of experience to see what's going on and maybe to see the injuries or illnesses that are being seen. Because that, again, from our experience, we can put that together. Once we've seen, we have an idea of the number, the magnitude of the disasters, what we would refer to it as. We can start anticipating the needs of the people on the scene. And we can also advise them as to how those injuries can be stabilized, or illnesses can be stabilized appropriately so that some people might not have to have immediate therapy. We can, through the camera and interaction with the physician or healthcare provider at the other end of the camera, help stabilize things. A great example would be, and I wasn't at this particular disaster, was the cult release of organophosphorus in the Tokyo subway system, where there were a sudden influx of people with a certain spectrum of clinical symptoms, and the first doctors who were taking care of them didn't understand what was going on. They knew they had a problem, they didn't know what it was. So I understand that someone typed in on the internet, say, gee, we're getting a bunch of these things, and these patients, we don't know what it is. And a toxicologist in Australia said, gee, it sounds like you're dealing with organophosphorus poisoning. And if it wasn't so obvious, or if they had in addition the images of the people there and were involved in the treatment area, I think that they might have been able to even further advise the doctors on how to treat. I mean, there were many people that died from inadequate treatment, even though the folks on the scene were doing the best they could. Once they knew what the problem was, they could focus treatment more appropriately. So that would be an example. I mean, that's a real life example. I've been to plenty of disasters where you see a certain pattern of illness or injury, and after a while you say, gee, I wish I had more of so and so. How could I improvise to handle that particular fracture or that burn? How do I manage radiation injuries safely so that the patient won't suffer subsequent infections? And if I had someone online to say, gee, let me look at this burn that you're dealing with or you're asking me about, or the lesion, let's say it's a staph infection, one of these deadly staph infections, then you might advise them what antibiotic to use, what dressing to apply, what surgical procedure to do. And I think that's a valuable tool. I mean, if I were at a telemedicine site in a remote area and we're suddenly faced with a disaster of the kinds we've talked about, I would love to be able to go to my installation and call upon the expertise of other people and say, gee, what do I do? And that would be a lot better than just being on the telephone or on a two-way communication device. I can tell you that from my own experience.